Monday before session, of course, it starts March the 9th, so 7 days a new legislative session will be upon us, and with that, very special guest to talk about not just previewing this session to come, but also some of the initiatives against the coronavirus statewide. Governor Bel Edwards announced this creation of the COVID-19 task force this morning after a pretty early morning meeting today with some state officials, public health sector, public safety, you name it. So here to talk about the coronavirus preparedness efforts and the measures the state has taken so far and the legislative session to come. Without further ado, Governor Bel Edwards.
Good afternoon, everybody. It's great to be back with you. And I really mean that. It's great to be back here in March of 2020. And we are 1 week from a legislative session. And I'm going to get to some things about the session a little later on. But I wanted to start, as was mentioned, by talking a little bit about COVID-19 or the novel coronavirus. You know, the CDC now expects that there will be community spread, and actually has been community spread in certain regions of the United States. And while that's true, the immediate threat to the general population across the country and here in Louisiana remains low, although the risk of exposure is higher now than it was just a few days ago because of this community spread. We are not, however, in the United States seeing the same type of spread that several other countries are. Obviously, particularly China, Iran, South Korea, and Italy. Just a few minutes ago, I finished a call with Vice President Pence and other governors from around the country to discuss the federal response to the coronavirus, including a supplemental appropriations bill, an emergency supplemental appropriations bill that they expect Congress to take up very quickly, potentially with the House of Representatives voting this week. It was an informative call. I appreciate the White House and the Vice President working to keep us up to date on this evolving situation. In addition to calls and briefings I have participated in, the Louisiana Department of Health has been in near daily contact with the CDC for weeks now, and to coordinate and to learn from the federal government, but also what other states are doing to prepare for this particular virus. There are more than 90 cases of coronavirus nationwide, and there have been 2 reported deaths from this novel coronavirus. And I keep saying novel coronavirus because it's, you know, this is not second hand. I mean, it's not second nature to me. I don't understand all of this, but coronavirus is responsible for 10 to 30% of all the common colds that you get. But this is a new strain. That's why they call it the novel coronavirus, because it's new, and we don't have effective treatments for it yet. The good news is about 80% of the people who get it report mild symptoms, like a fever, shortness of breath, coughing, respiratory ailments, and those sorts of things. And then, of course, the people who are most adversely affected are those who are elderly or those who are in some sort of a compromised state of health to begin with. But so what we're talking about is the novel coronavirus. This morning, I presided over our first meeting of the Unified Command Group that was related to this coronavirus that we're dealing with. And it was, for all practical purposes, much like a meeting we would have to deal with an approaching hurricane or other natural disaster, except that the briefings didn't come from the Weather Service. They came from the Office of Public Health. This meeting allowed all of our state agencies to get an update from our health experts about the current situation, and also make sure that we're coordinating across state agencies as appropriate. We announced this morning that late last week, we formed a task force of key agency heads and state partners from our Unified Command Group to hone in on every aspect of this response and to make sure Louisiana is doing everything it possibly can to identify cases, to control the spread of this illness and to respond in a way that protects the public health. The task force is recommending that all state agencies review and update their continuity of operations plans, which were developed in 2012 at GOSEP's direction, and we want to do that so that we can take into account COVID-19. To put this response in context, Louisiana has been working on pandemic preparedness for the last 15 years. We have a comprehensive state pandemic plan. We have also encouraged pandemic planning throughout the state, both in the governmental sector as well as the private sector. But there are a few important things for the public to know about the novel coronavirus. First, again, we don't have a confirmed case of coronavirus in Louisiana. Secondly, when we do have a case, specifically when someone is presumptively positive on a test, and by the way, we do believe it's a matter of when and not if that this will happen, my administration is going to announce that. In all likelihood, it will be me or it will be someone from the Department of Health. And so, you know, social media is good for a lot of things, but there's some things it's not very good at. And I would encourage people not to participate in some of the social media activity that's going on now. But when we have a presumptive positive test in Louisiana, we will disclose that at the state, and we will do it very quickly. I think this is important because the public's heard a lot of concerning information over the past few days and are probably going to continue to hear more of this over the coming weeks or months, even about the coronavirus. I hope that people will look for information from good sources like the CDC and avoid the gossip or speculation that we're already starting to see. When it comes to cases of coronavirus in Louisiana, if you've not heard it confirmed by the Department of Health, it is not real. Period. Our aim is to provide information that the public needs to prevent the spread of the illness while protecting the privacy of anyone who may find themselves infected, with this particular virus. Already in Louisiana, our health department has been communicated on a regular basis with health providers and doctors to proactively share information about symptoms and also guidance about when someone needs to be tested. I do encourage anyone in the public who wants more information, particularly at the state level, to go to ldh.louisiana.gov/coronavirus. ldh.louisiana.gov/coronavirus. We have the capability to test for coronavirus in-state, and the Office of Public Health will be handling those tests for providers across the state. Out of an abundance of caution, late last week, the testing protocol was expanded, and the new testing criteria are fairly broad, and most of the people who are going to be administered these tests we fully expect to be negative. That was the case in the one individual who was tested over the weekend, not the novel coronavirus. But if you present to a healthcare provider and you have symptoms that are consistent with coronavirus and no alternative diagnosis happens, then you will be tested. And it really is just that simple. And again, we expect to see cases here in Louisiana, so we want people to be prepared for that. I do want to say that there's absolutely no need to panic. In fact, there's not only is there no need to panic, that's exactly the wrong thing to do, but we should all take this seriously, prepare for this, and arm yourself with the facts. And know that you can take the following precautions. And by the way, this is going to sound a lot like what we tell you to do to avoid getting the flu, because you contract this virus the same way that you would the flu. If you're sick, don't go to work. Don't go to events like this. Cover your mouth when you cough. Cough into the crook of your elbow rather than out into your hand or out into space. Wash your hands frequently. I'm told wash your hands for 20 seconds with soap and water. And certainly if you've recently traveled to China, South Korea, Iran, Italy, or Japan within the last 14 days, and certainly if you experience any fever, cough, or other kind of illness, contact your health care provider as soon as possible and tell them about the symptoms and about the travel. Finally, it is still flu season, and your chances of getting the flu are much higher than they are getting the novel coronavirus. It is still a good idea to get a flu shot if you haven't already done that. And this will help because in the event that we have the spread of coronavirus, we don't need to be dealing with more people with the flu at the same time if we can help it, because you're consuming the same treatment, you're putting demand on the same resources that we're going to need for the coronavirus. Now, I'm going to take your questions about the coronavirus at the end of my remarks, but I do have just a few more to talk a little bit about the state and the legislative session and how we're going to continue to put the interests of our people first. First, we will be working very hard to pass a responsible budget that prioritizes education as well as other important initiatives like workforce development and health care. You've already seen my proposed spending plan, which includes $25 million in additional funding for early childhood education. So that would be on top of the $20 million last year. So that when I say last year, last budget, and that's effective this academic year, this fiscal year. And so what you would see next year is a total of $45 million more than we were spending year before last. That does not take into consideration a $33 million federal grant that we will have $11 million each of the next 3 years. So for the year that starts July 1st, that would be $56 million more for early childhood. More than $30 million in new funding for higher education, which represents the second time after more than a decade, or after a decade of having no new general fund investment in higher education. This would be 2 years in a row. And a $39 million increase to the MFP, which I am recommending be directed to educators in the form of another pay raise. Unfortunately, we're once again without a recognized revenue forecast by the Revenue Estimating Conference. We need that in order to know exactly how much money we have to budget. And finally, you need it because you can't pass a budget without it, because the budget would be immediately out of balance. So this conversation is going to be ongoing, and I'm optimistic that the REC will recognize revenue soon and that we're going to be able to move forward. But without the official forecast, we had to put forth an annual spending plan based on the lowest forecast that we can envision coming out of the REC. So it's always the case that when session starts at the very beginning of the budgeting process, but when that session starts without an REC forecast, you're certainly at the very beginning stages of that. Next, I want to highlight some of the bills that will be included in the legislative package. The first one should come as no surprise to anyone. I believed 4 years ago that $7.25 is not an adequate minimum wage. 4 years later, it's not an adequate minimum wage. In fact, I think the case has been strengthened that we need to do something in Louisiana to raise the minimum wage. So we will be supporting Senator Troy Carter's bill to make a gradual increase that will begin with $9 an hour in January 2021 and move to $10 an hour in July 2021. We've fallen behind too far for too long in Louisiana. Congress is out of the business. They've told us that. They haven't increased the minimum wage since 2009. It's important that we do this, and we know that an overwhelming majority of the people of Louisiana agree with us on this. We also know that we need to do some things about the high cost of auto insurance, and I think we ought to focus on making changes that are proven to have a direct impact on the cost of premiums. So I'll be supporting a series of bills by Senator Jay Luneau, all of which prevent insurance companies from using factors like gender or whether the driver is a widow or was deployed in the military to increase a driver's premium. You know, premiums ought to be set on driving records, not on whether someone's poor or female and that sort of thing. It's common sense. It's just the right thing to do. And obviously we will engage with the legislature on other legislative instruments that could potentially reduce auto insurance premiums as well. I do believe that there's plenty of common ground there that we can explore. The next set of bills that we'll be supporting will help improve the lives of women across the state. First, a bill by Representative Barbara Carpenter that will prevent employers from retaliating against employees who discuss or disclose their salary, and will bar employers from asking the applicant's salary history as a condition of employment. Simply put, I believe eliminating pay secrecy and improving pay transparency are important steps to ensuring that every individual is paid based on their merits and the nature of their work, not on their gender or the payroll of their previous employer. I also know that we continue to have the largest gender-based pay gap in the country. That is not good for our state, it's not good for our families, and it's not just impacting the ladies of Louisiana, it impacts the entire state, especially those children who are at home being supported by their mothers, whether they have another income earner in the house or not. They're being adversely impacted by this gender gap in pay. We already know that Louisiana has the largest pay gap in the country, and I believe when employers use salary history to set pay, it means that women who may be paid less will never catch up with their male counterparts, no matter their education, their experience, or their skill level, and that needs to change. We're also going to be working to improve workplace accommodations for pregnant women. Oftentimes, women who are pregnant get reassigned to desk duty, or if that's not available, they may lose their jobs altogether. But the reality is that pregnant employees can often continue to do their current duties with small accommodations like providing a stool to sit on or temporary assistance with heavy lifting. Sometimes the solution is as simple as allowing for more bathroom breaks. And finally, we'll be promoting the implementation of a maternal mortality review. This will ensure that any hospital or birthing center has written policies and procedures to investigate any maternal death and to do so in a timely manner. Louisiana maternal mortality rates exceed the national average, and we know that black women are 4 times more likely to experience a pregnancy-related death. This is unacceptable. We are already making tremendous progress in reducing the number of women who give birth and are suffering from hemorrhage, for example. But there's a lot more that we can do. These are just a few of the priorities that will be included in the legislative package for the session that starts next Monday. In the coming days, you're going to receive a list with more of our initiatives, and I look forward to talking about all of these bills in greater detail as we enter into the 2020 regular session next month. And of course, I will be addressing the legislature next Monday as well. So I'm going to pause here with the prepared remarks, get a drink of water, and then I will be happy to take your questions.
Okay, good time to reiterate. Again, questions will be open to members of the press club and those in the working media at the moment. And then I guess that's pretty much it. So back to you, Governor. Thank you. And if you can repeat the question. I
will try to repeat the question. I'm going to try to speak a little louder. I was told that some people can't hear. By the way, I find it warm in this room today. And especially up here under the lights. So if there's anybody out there with the ability to turn the temperature down just a little bit, I would appreciate it. Yes, sir.
Governor, you mentioned the coronavirus a little earlier. What's being done to prepare on the economic front of this? I know the whole nation is feeling it right now, so the whole globe. What's being done statewide on the economic front to brace against any backlash there?
Well, you know, the question is, what are we doing here in Louisiana to try to lessen the economic impact, the toll that's being taken by coronavirus? Look, that is extremely difficult, and I'll give you one small example of what we're dealing with, and then if you think about this in the context of everywhere else that it could potentially play out. So we know, for example, the Port of New Orleans has ordered 2 cranes that they need down at the port, and they're coming from China. Well, we now know that there will be a delay in receiving those cranes because the work isn't progressing as it had before. and I'll mention this second example because I think it's important too. We have had a run on masks, surgical masks. And by the way, the Surgeon General of the United States and our own Office of Public Health says you're not going to do yourself any good by going out there and getting a mask. So, but go on eBay and buy them if you want to, but they're going to be very, very expensive. But not only has there been a run on them, but most of those masks are produced in China. And even if they're assembled in Louisiana, in the United States, the materials typically come from over there. So it's very difficult at the state level to do things to try to prepare for or minimize the impact. I think what we can do to minimize the impact of novel coronavirus is to make sure we do all the things that I mentioned before, so that it doesn't spread more than it should or would if we followed all these precautions, and then not to engage in panic or hysteria, but be driven by the facts as it relates to coronavirus. And if we do that, we'll get past this sooner than later, and hopefully without it getting as severe as I know some people have indicated that it might. It is still the truth that far more people have died this year from the flu than from coronavirus, and every year from the flu. This is new, and so it's cause for concern. It is not cause for panic. Yes, ma'am.
Should we be concerned that there aren't enough testing kits and things available?
Yeah.
That's what we're hearing from across the country.
Well, I'm going to repeat the questions, but the question is whether we should be concerned that we don't have enough testing capacity. That is not a concern that we have at present. One of the things I just spoke with the Vice President and his team about, including Secretary Azar and others on the phone call, is they're ramping up additional capacity for testing very, very quickly. So we don't anticipate that this is going to be a problem. Right now, we can administer the tests in state. We will get a preliminary finding, whether it's positive or negative. If it's positive, we will call it presumptively positive, because we then send to the CDC and they will either confirm it or not. But once they confirm it, then we have a confirmed positive result. But right now, we don't have an issue with respect to capacity, and we think that this is going to greatly increase going forward. One of the things that we are trying to make sure of is that we have enough lab technicians to make sure that we can process these tests. And this is a swab test is what they're using, by the way. Yes, ma'am.
Governor, let me ask you about the Beth Mizell's and Bel Edwards bill that is titled Save Women's Sports. Do you have any commentary on that? It prohibits any transgender individuals from participating in gender-specific sports.
So the question was whether I have any comments about a bill that's been authored by Representative Bel Edwards and Senator Beth Mizell as it relates to, I think, transgender women's participation in sports. The answer is I do not. There are so many bills that were filed, and we are just now starting the process of going through those, reading those to identify those we support, those we might need to oppose, or where we would recommend that changes be made. But I'm just not prepared. If you looked at the list of pre-filed bills, there are hundreds and hundreds of them, and that process just ended. And by the way, once the session starts, each legislator can file 5 more. So this is not going to get any easier anytime soon. But at some point, we will be ready to talk, not just about that bill, but about others as well. Yes, ma'am.
Okay. It's my understanding that you're supposed to have a phone call, or you either have or are supposed to have, with officials from St. Joseph's Academy regarding the group of girls who just returned from Italy who may or may not be being quarantined right now. Did that happen?
I have not had a call with anyone from St. Joseph's about that. when individuals return to the United States, the federal government communicates with us if they are coming from a place where the heightened scrutiny is in order and testing and that sort of thing. Right now, and this is as of the phone call we were just on, all of Italy is not at issue when it comes to travel. It is a certain region of Italy, in northern Italy, around Milan, in the Lombardy region, I believe. But we haven't had that discussion about these particular young people from St. Joseph's Academy. We have had somewhere around 40 or so overall people that traveled into the state who came from places that caused the federal government to let us know that they were here, all of whom have cooperated with us fully, and they are isolating themselves at home until they get past the 14-day window. They're taking their temperature twice a day and calling in once a day and that sort of thing. And about half of those individuals have been released from that because they're outside of the window that this would be an issue. But that's, if we have any more information about a specific group, we'll let you know later, but it just hasn't happened with respect to the question you just asked. Yes, ma'am.
Two questions, Jennifer Brockman with WDSU.
I'm going to object for the record. It's a compound question.
I'll separate the sentences.
No, go ahead. I'm sorry.
So the number of Louisiana residents, not just people we've visited through, who are currently under quarantine, maybe even in other parts, and also specifically to New Orleans, we're so dependent on tourism and port activity. Was any part of your conversations today specifically addressing festival season, Jazz Fest, the port, anything constraining any of those?
No, and no activities in New Orleans, no conventions, no festivals. We just got through Mardi Gras last week. None of that has been canceled or curtailed. We haven't had groups cancel any plans or anything like that. I think where you're seeing things canceled, they are in the other countries that are going through this. And so maybe in Korea, certain parts of Italy, and so forth. Now, obviously, there are certain interventions that become wise depending on what happens. And we hope it never gets to the point where we are having to curtail the ability of certain assemblies and that sort of stuff. But we know that this novel coronavirus spreads, because of contact between one human and another, and so forth. I mean, that's just looking so far down the road. No interventions like that are called for at this time. And one of the things that we've been urged to do by the Centers for Disease Control, and again today by the Vice President and Secretary Azar, is not to have unnecessary disruption now from just normal everyday life, because it isn't warranted. And all that would do is needlessly cause people to panic and so forth, and have more disruption upon the economy and so forth than would be warranted under the circumstances.
And then did you have a count of the number of Louisiana residents under quarantine?
What's the question?
The question is how many Louisiana residents under quarantine. I don't believe quarantine is the right word for a single Louisiana resident. We have some that we've asked to isolate themselves in their homes, and I think we're talking about a couple of dozen people at this point. I've got my experts back there shaking his head, so it's about a couple of dozen folks, and by the way, none of whom are even symptomatic at this point. Yes, sir.
Governor, Tulane is one of the first facilities in the country to get CDC approval to study coronavirus. Have they discussed with you the status of the vaccine?
No. I heard someone, and I can't remember who it was, at the President's press conference last week explain the process of developing, testing, mass producing, and making available a new vaccine. And I can't remember where it came out. Even if this is the fastest one that's ever made available, you're still looking at more than a year. for that. But I haven't had that particular conversation with folks at Tulane, although I would encourage them to do everything that they can. Yes, sir.
Governor, 4.5 years ago, right behind that podium, you said that Louisiana's $50,000 jury trial threshold was, and I quote, fair, reasonable, and strikes at the right balance, unquote. Are those still your sentiments today?
The question is about the jury trial threshold, which in Louisiana is set at $50,000, has been for a long time. I don't particularly have a problem with the $50,000 jury trial threshold. It is something that I know obviously some people feel differently about, and I'm happy to engage with them in those conversations. Yes?
Governor, I'm wondering what conversations you've had with the incoming legislative leadership, the new House Speaker and the new Senate President. Are you kind of working together? Are there any areas of agreement you've found, or are you talking to them regularly yet? Or
Yeah.
what's the relationship?
All right, so the question is the conversations that I've had with the new Senate President, Paige Cortez, and the new Speaker of the House, Clay Sexsnyder. And I have had several meetings and conversations with each of them, and our personal relationship is just fine, and we're communicating just fine. I am optimistic that we're going to be able to work together to tackle the big challenges that face the state of Louisiana. And you know, my approach for this term will be the same as it was over the last 4 years, when I also was working with a majority Republican House and a majority Republican Senate, although the circumstances were vastly different. We're no longer talking about a $2 billion deficit or a fiscal cliff. We're talking about 3 consecutive surpluses. We're talking about a growing economy that's the largest it's ever been and the 4th fastest growing in the United States of America. And we're talking about continuing the critical investments that we've started again in things like higher education, K through 12, and early childhood. Trying to make sure that we maintain the momentum we have with respect to health care in Louisiana. We have the lowest percentage of people without health insurance today in our history. It is saving the state hundreds of millions of dollars. We haven't lost a single hospital as a result of it, in contrast to states all across the South where hospitals have closed by the dozens. Most importantly, people have access to primary care and preventative care. And you know, I've got this new initiative on rural revitalization. And certainly we have challenges, as does rural America. But one of the challenges we don't have is a bunch of hospitals out there that are closed. Because if you go to a small rural community where you find a hospital, you're typically looking at one of the biggest employers and one of the largest payrolls in the parish. Secondly, if you try to attract people to move to or invest in a community that doesn't have a hospital, good luck. And so these are some of the things that we've actually been doing well, although I acknowledge we do have particular challenges out there. And that's a long answer to a simple question, but I will tell you, I feel very optimistic that we're going to be working together just fine to tackle the biggest challenges that we have as a state and to continue our forward momentum. Yes, ma'am.
Governor, do you have a preference among the 21 candidates who
No.
submitted their name to the superintendent of education?
Oh.
Democratic president?
No. In fact,
You can answer both now. You have a preference on the Democratic presidential candidate?
I thought you were talking about the people who want to be governor next, so we'll deal with that later. No, actually, I think that list was finalized late Friday. To be honest with you, I haven't even gone through all 21 names. I do hope we will pick someone who is a champion for education. I want us to pick someone who doesn't need a waiver from the requirements that the legislature set into law to be a superintendent, someone who has spent time in the classroom, someone who has seen education from a variety of perspectives. And I believe that we have multiple candidates who fit that bill, and I would call upon Bessie to proceed in that fashion. Yes, sir, Mr. Hightower.
I know we've had some apparent difficulties in the judiciary in recent months, and there's a lot of bills that are introduced you can tell us about your position on merit selection?
Yeah.
Merit selection of judges?
Yeah, so thank you, Mr. Hightower. He's asking about my position on the merit selection of judges. And when you hear that presented, typically what they'll say is, well, we need to do that and get the politics out of the system. There is no way to get the politics out of the system because it's going to be an elected official who would name those individuals to the judgeships. It's just somebody else's politics rather than the voters. I happen to think that we should trust the voters to decide who the judges are going to be, you know, nobody should be surprised when you have hundreds of members of the judiciary that you're going to have a few who misbehave. Obviously, we don't want that to happen, and we need to guard against it, and we need to make sure that when it happens, it's dealt with swiftly. But I don't believe that there's enough of that to warrant a changing from the current system that we have of electing our judges. I think we can trust the people of Louisiana to make good decisions, and I think they adequately lived up to that this past year when they reelected me. I could tell some people weren't following on that one. Yes. Oh, I'm sorry, over here.
Governor, as you alluded to, you've been pushing for an increased minimum wage for quite some time, wanting to end pay secrecy for quite some time. What reason do you have to believe this time could be different?
Well, first of all, we're not going to stop trying until we're successful because we know it's the right thing to do. We also know that overwhelming majorities of Louisianans agree with both of those. So we're not going to stop. And look, it's my hope, my expectation that we will be able to prevail upon those who have not seen fit to support those measures in the past, both legislators and groups like the Louisiana Association of Business and Industry, the National Federation of Independent Businesses, and so forth, just because it's time to do it. It's the right thing to do. And we're going to keep working extremely hard, and hopefully we can find the right way to talk to and convince these people. But I'm encouraging folks all across the state of Louisiana to contact their members of the House and the Senate and talk to them about addressing this gender-based wage gap, addressing the minimum wage. And there's no reason why it can't happen, and especially with so many new members who maybe haven't even formed an opinion on this yet, that it can be done this year. Yes, sir.
Governor, how you doing?
I'm well, thank you.
Good. As you know, I have family and friends and properties on both sides of the Mississippi River. We live in Kansas City. My question relates to revised statute 30:51 in its current form, which I've tried and now run for office, public office, statewide, twice to try to get, attention drawn to that issue. And look, with respect to the Attorney General, all of these are just allegations. Okay? But those allegations, in my view, have highlighted the need to do something about that. And my question to you is, in your view, would anybody that's running for district attorney now, in my case, they're really all Democrats, have cause for concern or heartburn that the legislature doesn't do anything this session to appropriately amend or even repeal revised statute 30:51? And I assure you, your executive council knows the danger of that statute.
It's a question about Louisiana revised statute Title 30, Section 51. And, I don't have a specific response for you today on that. I can tell you, because I know that you prefaced your question with where you live and so forth. I will tell you that we are basically auditing the tumor registry now to ensure its completeness and its accuracy, and that will be a really good indicator of whether there is a heightened issue in the area that you speak of. But I'm not prepared to discuss whether the legislature will see fit to amend or repeal that particular statute. I just don't know today.
My question is, do you think district attorneys will have a problem if they don't?
I don't know the answer to the question. I'm sorry.
board?
Yes, sir.
Governor, do you plan to vote in Louisiana's Democratic presidential primary on April 4th? And if so, who are you going to support?
I always vote.
Repeat the question. Come on.
Okay, the question is whether I will vote in the Democratic primary in Louisiana. The question is yes, and you can ask me later for whom I'll vote, because we don't even know the lineup yet that will be on the ballot here, or those people who will still be in consideration. Look, I think somebody said that. Was that you, Christina?
That was me.
All right. Look, thank y'all for the opportunity to be with you. I look forward to addressing the legislature a week from today, and then working with them over the next 3 months to successfully bring the session to a conclusion with a good budget that allows us to adequately fund our critical priorities and continue moving the state of Louisiana forward. As developments happen around the novel coronavirus, you will be given the information. So we will be proactive in reaching out to the media with new statements and press releases and so forth. Well, thank you very much. Thank God for you too. I'll see y'all later. Appreciate you.